Good morning. This is Dr. Yogesh, HOD, Department of Physiology, Sri Chamundeshwari Medical College Hospital and Research Institute, Channapatna. Okay, in this video, we are going to learn examining the reflexes. So there are two parts, superficial reflexes and the deep reflexes. In superficial, you have the conjunctival reflex, corneal reflex, and you can do the plantar reflex, abdominal reflex. Conjunctival and corneal, it is going to come in cranial nerves also. So here what we are going to do is take a wisp of cotton and from the side, stand beside the patient, and you have to touch the white part of the eye using the wisp of a cotton, and you are going to see reflex closing of the eye. This is for the conjunctival. In corneal, you are going to touch the limbus, that is the corneoscleral junction, and again response is going to be blinking of the eye. Ideally, better not to do the corneal reflex, just know the procedure. Plantar, I will show how to do. Now, I will proceed with the deep tendon reflexes, starting with the biceps reflex. So, in this one, it becomes the positioning of the patient becomes very important. So, whichever the muscle reflex you are trying to elicit, always expose that particular muscle. It's good to expose. Okay. Now, see, I am going to make his hand totally relaxed on my hand. The supporting is very important. Okay. Now I feel the biceps tendon. Okay, I can feel the biceps tendon. Okay. So with the tip of the knee hammer, you just give one tap. The tapping, the movement should happen at the like an arc. It should happen. And you can see the constriction of the muscle. This is for the biceps. Again, same thing you should do on the opposite side also. Whenever the reflex is not coming, you cannot directly write it is absent. Before doing it absent, you have to perform a Gendrasic maneuver. What is Gendrasic maneuver? Here now what is going to happen is, let's say I was trying to elicit this reflex didn't come. So what I'll ask the subject is, with the opposite hand, you should make a tight fist on my command. Whenever I say, you please do it. Okay. So I'll just keep it here. Okay, sir, keep it ready. Okay, start folding now. Make a fist, make a tight fist, and I elicit. Okay. Or you can also ask the person to clench the teeth on your command. So when the patient is clenching on your command, you try to elicit the reflex. Even after this, if the reflex is not coming, then you can write reflex is absent. Okay. So that is for the biceps. When you are eliciting the reflex for the lower limb, if the reflex has not come, then the Gendrasic, what he has to do is, he has to just with both the hands try to hold it like this, and he has to just pull it apart on your command. So this is the Gendrasic when you are performing the lower limb reflexes. Let us proceed with the triceps. For triceps, there are again multiple ways are there. So the best way is go behind the patient. You have to lift the patient's hand. Okay, patient is not lifting. See, if I do now, he is actually holding it. If it is like this, reflex will not come. Okay, so relax, sir. Please relax, fully relax. Okay, I will lift you. Don't do anything, sir. Just relax, and just above the olecranon with the broad end of the knee hammer, just give a bold tap like that. So you are going to see this particular movement happening. This is for the triceps. Then for the supinator, please come closer. For the supinator, it is just like giving a handshake. Okay, just giving like a handshake. Hold his hand, support the joint here, just above the styloid process here. Just give one bold tap here. Okay, so whenever you do this, you saw that contraction. That is for the supinator. Let's proceed with the lower limb. This comes here. Okay, so in the lower limb, the knee jerk. Come a little forward, sir. Yes, okay. Okay, this is also the best way. You can also sit with the cross legs also, you can do it. but making the person to sit on the couch is a better way. So now here what you will do, you can feel the patella, the triangular bone, just feel down and go down. See, you can see that it's coming down like that. Just below, wherever it is ending, there's a soft spot there. On that soft spot, with a broad hand, give a nice tap in there. That is going to, that is for the knee jerk. Next is the ankle jerk. Please like it. So this is the. So for the ankle jerk again, the camera person comes this side. Yes. Now what I will do? Relax. I will place this leg. You can either place it in the side also like this, or you can place it on the opposite leg also. Both are fine. Okay. Now what I will do, with my one hand I am going to dorsiflex. With my other hand I am going to hit at the tendon of Achilles, and you are going to see the plantar flexion. Okay. This is for the ankle jerk. Ankle jerk can be done another way also. You can make the subject to place the leg over the chair. Once again, it's good to expose the muscle, the calf muscle, and you have to dorsiflex in one hand and hit on the tendon of Achilles. Okay, that is for the ankle jerk. In the superficial reflex, we were talking about the plantar reflex. So in plantar reflex, now what I am going to do is I am going to stabilize the ankle joint with a blunt object. What you do, you make an inverted L. You from the little finger side, from the heel, start down and make it turn like that. You saw all the toes trying to adduct inside. In the Babinski, what is going to happen? You are going to see fanning and abduction of the toes. That is for the plantar. And abdominal reflex also, what we are going to do? No need to remove it. What we are going to do is, over the abdomen, now let's say the coastal margins are like this. Okay. So from outside to inside, on the coastal margin, parallel to coastal margin, just give a nice quick stroke like that, and you are going to observe a small contraction of the abdominal muscle. Okay, so these, and one more thing we have left out, this one, jaw jerk. So the jaw jerk, yes. So jaw jerk is there in the cranial nerves also. So here also, as part of the deep tendon reflexes, so open the mouth little hard. Okay, I am going to place my finger over there, and the hitting should not happen straight. You should hit in an angle like this, so that when you hit in the angle, what is going to happen? You are going to stretch the jaw. All these reflexes, how they are working? When you stretch a muscle, it is going to respond by contraction. But if you hit straight, you are not going to stretch a muscle. So always the action should be upside down like this. You just do upside down. If this also reflex is also difficult to elicit. If it comes nicely, you are going to see closure of the mouth. When sometimes you will be able to hear a very loud bite sound where the reflexes are very much exaggerated in the upper motor neuron lesions. So these are the things about the reflexes. Thank you.